Welcome to the channel, Met Cancer, Metabolic, Not Genetic. I'm your host, Vince Gledhill. Now, I'm not a doctor, and none of this is medical advice. I'm just some random bloke on the internet. This may be the ramblings of a madman. Now, in today's video, a snippet from a recent interview with Domenic D'Agostino, and his opinion about the importance of exercise.
Like muscle wasting can occur incredibly fast. So it's just good to be cognizant of that and design your diet with an anti-catabolic muscle sparing effect in mind. And of course, the diet should be coupled with some form of exercise. You don't have to be deadlifting and squatting and bench press. You know, you could do that, and they are big levers to pull for keeping your muscle. And muscle has an anti-cancer effect because muscle releases various myokines, and your muscle is basically an endocrine organ that releases substances that are anti-inflammatory that can, prevent cancer cell growth. And your muscle is also the metabolic engine that makes metabolic therapies work, because that becomes your sink for glucose, right?
Yeah.
That helps you keep your glucose low, and it stimulates fat oxidation, and that accelerated fat oxidation is actually what drives your ketones up. So, it's really important to exercise is synergistic with diet, meaning that if you just did exercise for cancer or you just did diet for cancer, 1 and 1 equals 3, I guess, is the easiest thing to say. So when you couple the two together, there's a whole field emerging called exercise oncology. And they take patients that they don't even follow any kind of diet. They just exercise them and they're getting remarkable results. So if you couple that with ketone metabolic therapy, then, that's a remarkably synergistic. So that encompasses what we're talking about as the press, right? And then there's pulse protocols is kind of like a whole nother thing that we can talk about too.
Yeah. I mean, for anybody actually watching this video, check out my video with Jason Watson, who has worked extensively for himself and has 5 meals a day because he was wasting away, and he's a patient that's managed to get himself brought round, and he's now fully in metabolic homeostasis, shall we say, but he's also gaining weight, which is remarkable, really. Given what he's been through.
Yeah, putting on that muscle weight is really important. And I mean, it could just be walking. Walking stimulates the big muscles of the body. You want to take it up to another level. You could throw a backpack on with 10 pounds. We call that rucking. Here in the US, it's like a sport. Rucking's like a sport. I actually do it because I'll go walk the dogs for about 2 miles a day, and I'll throw on like a 50, 60, or even an 80-pound pack if I'm doing a short walk, an 80-pound, and all that gives your entire body sort of resistance, and that can help really maintain muscle. I've seen older patients build 5 pounds of muscle just walking, just getting up and walking, especially if there's hills around their environment. They're adding muscle to the legs, and that's your metabolic engine. So that's really important to do that. And I think we don't talk about that enough when we talk about metabolic therapies for cancer. But also just getting outdoors and walking influences your brain. It has a psychological effect. It reduces stress. That's going to impact your glucose and all these things. So I think that's also a major factor too.
That'll do it for today. Please like the video if you did, and please subscribe for more snippets like this to come. And if you did enjoy the video, please consider supporting the channel by visiting metcancer.com/support. Don't forget to like the video if you did, and click here to subscribe. And why not check out this video next?